for a safe space where healing might take place, where everyone is valued. Given tools to maintain where equity matters. Less talk, more action, where anyone is welcome. Don't send them home packing, this is strong talk. When conversation pops off, speak life, reflect hope, promote choice and love folk. Strong talk, real talk, no jokes. Recovery, culture, community. Let's go.
Hello and welcome to Strong Talk, a podcast dedicated to the discussion of equity, diversity, and family as it relates to mental health and addiction. A space not only to talk about challenges, but to explore and to create space for solutions. I'm your host, Vic Armstrong, and I want to thank you all for joining me on this journey. I'm joined today by Dr. Tia Dole, Chief 988 Suicide and Crisis Lifeline Officer with Vibrant Emotional Health. Dr. Dole, thank you for joining me today.
Thank you so much for having me.
Absolutely. So you have a huge role. Obviously, you have a little bit of a long title there, but you have a huge role with Vibrant. And I know that people have heard, they've heard a lot of probably about 988 to this point. I don't know how much people understand about what goes into to creating the 988 number and rolling it out and making it accessible to people. So for starters, can you talk a little bit about your role, and then tell us a little bit about what 988 is.
Absolutely. So what I'll start out by saying is the National Lifeline has been around for nearly 20 years. And it has actually been administered by Vibrant since then. And we used to be MHA NYC. And so over time, you know, the first year that the National Lifeline existed, it served about 45,000 people. And today, 988 serves 5.5 to 6 million people a year, which is a huge, huge leap. But now 988 is primarily funded by SAMHSA. And what that means is that Vibrant is in a cooperative agreement. This, you have to tell me this is too much detail, but Vibrant is in a cooperative agreement with SAMHSA. So we're the administrators of 988, which means that we make sure that all the back end telephony is up and running, that the QI is up and running, that all the 216 crisis centers in our network are able and ready and able to answer calls in a timely manner, and making sure that the people that are served by 988 are served well, regardless of their identity.
So, you mentioned that Vibrant used to be MHA. So, which to me is important because it also says that Vibrant has a mental health background. So Vibrant is not just you know, some communications.
Oh yeah. Well, Vibrant has a lot of other things. Yeah. We have, I mean, we're sort of like, we've been around for 60 years. And a lot of our work is around, like we have a call center, but we also have community-based programs throughout New York City. And so, you know, I would say my favorite new one, because I work, my work is really centered around intersectional identity. And so they just are starting up a clinic in Queens, which is a borough in New York City, for LGBTQ youth and their families. And so Vibrant is, you know, beyond 988 has quite a few other programs that are based in the community that serve people directly.
So, okay, so that tells us a little bit about Vibrant's relationship to 988. So tell me about your role. How are you involved in this? What does your day-to-day role look like?
Well, it depends on the day. But ultimately speaking, you know, my name is on the cooperative agreement with SAMHSA. So officially, I'm the project director for 988. And I am the person, the buck stops with me. I'll just put it that way. I am the person who is in charge of making sure that everything is running. And so we have a lot of things that we have to do, we get to do, I'll put it that way, as part of our agreement with SAMHSA. And, you know, I'm the person who's accountable for it. So it's a funny thing to be. Sometimes I try not to think about it. And I'm like, oh my goodness gracious, like I'm actually responsible for the success of the project. However, my team is amazing. And on top of that, all of our crisis centers in the network are incredible. So yes, I'm the accountable one, but the work is not done by me. It really is done by people who are dedicated to this work.
And so Vibrant is headquartered in New York. Now, let's say, for example, my father's 82 years old, and he lives in Plymouth, North Carolina, population about 4,000. And let's say my
Okay.
father has never heard of 988. How would you
Mhm.
explain what 988 is to an 82-year-old Black man living in rural northeastern North Carolina?
Well, first, I would say that your father probably wouldn't appreciate your assumption that he wouldn't know based on who his son is, but he better know what 988 is based on your work. But what it's the analogy that a lot of folks use is it's 911 for mental health.
Mm,
I don't love that analogy because I actually don't want people to wait until there's an emergency to reach out to us.
yeah,
988 is a resource for people in crisis, but it's also a resource for people before they are in crisis. And it's a resource for family members and loved ones who may have someone in their life who is struggling to get help. And so 988 is sort of like, I don't know if you remember 211.
mhm,
Uh, Mm, right. It's a combination of 911 and 211 for mental health. But it's also a place where people can just call and, speak to us. I think people use the line also because they're incredibly lonely. And you're speaking about your father's small town. Be curious
yeah,
to know if there's any mental health professionals there. And so we do have older adults who reach out to us who aren't suicidal, who just need someone to talk to. And we love that. We love when people reach out to us because preventing people from becoming ill or from becoming more symptomatic is also part of our role.
yeah. And to your question about my hometown, like um, a lot of areas, a lot of rural areas, there is no psychiatrist
Mhm.
in the county where my father
Yeah.
lives. The county where I grew up, North Carolina, out of the 100 North Carolina counties, I believe there are 22 that don't have a psychiatrist. So Washington County, where my father lives, is served by um, psychiatrists that would have to transport in from other areas, and you have to transport out to go see them.
Mhm.
And so there are a
Mhm.
lot of resources that are there, like a lot of rural areas too. They're very law enforcement dependent for a response when
Mhm.
someone is experiencing a mental health emergency. So the
Yeah.
idea of being able to call a number and have a mental health response it
Mhm.
is a welcome idea for a lot of people. I know there are
Mhm.
challenges in a lot of communities, especially rural communities, in um, once you have the number and you have that number to call, having that response, the next component to have
Mhm.
someone to actually
Mhm.
respond to it, and having a place to go once they have been responded to. Those challenges still remain in a lot of ways
Mhm.
for rural communities. So, and that's part of the reason when I say, my father probably doesn't know what 988 is, I have to ask him, I have to test him and
Mhm.
see if he really knows. But partly because I think for some rural communities, um, their perception of right now the value of 988 for them is different
Mhm.
because they don't anticipate getting a different response when they call
Yes.
988 versus 911.
Well, I think I actually love talking about rural communities. One of my cousins is actually like this assistant commissioner of rural mental health in Texas, which is kind of a funny thing. We both ended up in mental health, but I think the SPRC just actually released research. They call it formative research,
Now, for anyone who
and
may
one of
not
the
know,
biggest things they were talking about.
can you tell me what
Hmm?
SPRC is in case someone may not know?
Oh, 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 Suicide Prevention Resource Center. Yes?
Thank you.
Okay.
Yes.
So that's a test. They actually produced some research about like what people actually need 988. And one of the
Mhm.
things that have come out is that men in rural communities are sort of like in desperate need. But
Mm.
you're bringing up your father in North Carolina, and I'll say my part of my family grew up in Rocky Mount, which is also
Oh,
in North
wow.
Carolina.
Yeah.
Yes.
It's about an hour from my hometown.
It's in okay, okay. It is also a smallish town. I mean, it's bigger than your town. When you think about rural mental health, this is where that whole intersectional identity, right? I
Mhm.
would assume that your father is a black man. And he grew up in over, you think about it, he's what, you said 82?
Yes.
So he was born in the 30s, and you think about all the
40s,
different things that
like
he has seen.
41.
40s, okay, 41, okay. all the things that he has seen happen in North Carolina.
Mhm.
So when you're saying, well, there's not a lot of access to resources, that's not the only barrier for him to receive treatment,
Sure.
right? It's who's available to see him,
Yeah.
whether or not they're going to see him as a person,
Mhm.
whether or not he's going to get fair treatment, right? And it's complicated. And so why I think 988 is super important in rural communities is, for a lot of folks, it is their only mental health.
Mhm.
Is it like you're saying, oh, we can look at driving 90 miles with the price of gas for someone on a limited income is not an option. And I actually think this is where telehealth has really, I think,
Yeah.
changed the game, which is that you can see people all over your state and actually, the ability to potentially see a psychiatrist eventually outside of your state, I think is going to be really key personally, because there's just not enough providers in certain locations.
Yeah, absolutely. I love the idea too. I think you said earlier, thinking about 988 as also prevention, not just with when someone is at that point of
Hmm.
crisis, but also prevention. Because you're right. I mean, there are a lot of people that um, even before you reach that point of being suicidal or experiencing a mental health emergency, there are often opportunities
Hmm.
to intervene before a person reaches that point. And the idea that
Hmm.
988 can be a part of that intervention, to me, is one of the things that I think a lot
Hmm.
of people don't really know about or appreciate about 988.
Hmm. Well, I think people ask me all the time, like they're like, oh, is 988 going to end suicide? No. 988 is a very big stop on the crisis continuum, right? And we connect folks to post-vention services, right? We connect folks to ERs, we connect folks to mobile crisis teams, right? You think
Mhm.
about, in some ways, we're not the solution. We're not going to be the ones who end suicide, in part because why is there a suicidal crisis? Well, there's lots of reasons. That's a whole separate conversation, which we can have. But we are a prevention, we are intervention, and we're a connector to services. And so you have this crisis counselor who lives in North Carolina. If your father, ever happened to call, right now we're routed by area code and eventually we'll have geo routing. And so
Mhm.
that counselor will be able to say, okay, in near your town, there is this clinic that might take your health insurance, right? Health insurance is always a barrier. And they actually, I called them yesterday and I happen to know that they have some spaces, and that connection before there's a crisis is so key. And not for nothing, people on 988, the counselors are always hoping that they can be helpful to people. And at
Yeah.
about 13% of calls are like in the super high risk. But if think about the opposite of that, only 87% of the people who reach out to us are not in a suicidal crisis. And that means that we might have prevented, the millions of people from becoming suicidal.
Yeah. One of the things I think about too, and especially as a black man, um, who recognizes that oftentimes law enforcement encounters with black males um, don't always end well, and especially when you add to that a person who's in a mental health emergency, where you're in this elated state, or where
Mm-hmm.
the way you present may seem disoriented. Um, so one of the things that I always think about is that while we market 988, as we should, as a resource for a person to call if they're experiencing a mental health emergency, or if they need to reach out to someone to talk to, or for social connection, or whatever it is that they're reaching out to 988 for, the thing that I also see as an opportunity, though, is to educate bystanders that if you see someone
Mm-hmm.
having a mental health emergency, call 988. Because I always feel like, and this is part of my, part of my, I guess, my story, my baggage that I have to deal with. But I always feel like if someone sees me having a mental health emergency, they're going to call 911. Their
Yeah.
first response is not going to be, let me call
Right.
988 because I want to make sure he's okay.
Mm-hmm.
Their response would be, let me
Mm-hmm.
call 911 because I want to make sure I'm safe from him. And so I'm
Mm-hmm.
hopeful that going forward, we'll see more education of bystanders that this is a resource that you can use to help someone else who may be experiencing a mental health emergency?
Well, I think I appreciated the delicate way that you phrase that. So I'll start out with the top of your, what you were saying. I think it's wildly inappropriate to expect police officers to be social workers
Mm-hmm.
and to talk down someone in the middle of a psychotic crisis. And I can't say that enough. It is not asking a 22-year-old kid who has not been trained as a mental health professional, and as someone who's worked in ERs, as someone who's been to people's homes who are in the middle of a psychotic crisis. It took me years of training to know how to do that. And so
Mm-hmm.
to expect a 24-year-old, 22-year-old police officer to do so is irresponsible. So there's that. I think that the other parts that you started to talk about, which is as people of color, we are at grave risk to
Mm-hmm.
police at times. I don't think that I try to stay in the positive notion, which is I think that people don't want to hurt other people, generally
Right.
speaking. I wouldn't be a clinician if I thought people
Right.
generally wanted to do that. But when you, as a young person or even an older police officer, are faced with someone in the middle of a crisis and you actually don't know what to do, you're going to lean into the thing that you know how to do, which is to use
Right.
force.
Yeah.
And using force on a person in the middle of it, that's you know it's inappropriate, right? And so letting the public know that we exist and that we're an option for someone who is in crisis is key. I think the other part of it is that you know having folks understand what a mental health crisis is and looks like is
Mm-hmm.
also key. So
Yeah.
it's like knowing that we exist, but also understanding, okay, this person is really struggling, and they seem agitated, right? Usually 911 calls because someone's pacing, they seem really agitated, they might be hearing voices, they might be manic or whatever. And the first thought, right, to your point is like, we need to call 911 because
Yeah.
this person is going to hurt me or hurt other people. That is the concern, or even themselves. And so knowing that we exist is key, but we know that from our research, and of course, the people listening to your podcast already know we exist. And so, how do we? You're preaching to the choir, literally.
Yeah.
So, how do we let people like your father know that we're here?
Yeah.
That's the key.
Yeah. Yeah, it is a key. And I love the fact that, and I know a lot of people don't know. I mean, they see the result. They don't always see what goes
Mhm,
into the work of rolling out something like 988. And in part because
mhm,
of the work that I do, I have probably seen it a little bit more of the build up than the general public have. And I can also appreciate the fact that a lot of the conversation around 988 has been how do we message this to historically marginalized communities? How do we help historically
mhm,
marginalized communities to feel safe in calling? How do we help historically marginalized communities to feel like they're part of the target audience when we're talking about the rollout of
mhm,
988? But I also understand it's a challenge because
mhm,
for a lot of people, there's a fear. There's a fear of the system in general, and we all kind of get lumped into we're part of the system. There are
right.
even where there are real stories of bad outcomes for Black and Brown people or LGBTQ individuals who have reached out and had bad outcome when they were calling to law enforcement. The truth of the matter is the overwhelming majority of those encounters don't end up badly,
That's
but
right.
we hear about the ones
Mhm,
that do. And so there is a narrative that we have to overcome. Um,
mhm.
can you talk a little bit about that, especially as a person of color, trying to do the work to overcome that narrative? What are some of the challenges, and are there things you can point to as indications that we're trending in the right direction?
So it's interesting because I think representation matters. So I'll start out by saying, as a very light skinned Black woman, I'm the first person of color to lead the National Lifeline in nearly 20 years,
Mm,
right? We have Monica Johnson, who's the director of 988 and behavioral health over at SAMHSA, also a Black woman,
mhm,
first time. And then you have Brandon Johnson, who is head of suicide prevention over at SAMHSA,
mhm,
Black man, also first time. And I do think this was not planned. This just happened to play out like this.
Yeah.
But I do think that um, seeing people like us talk about these things matters, and that when people, call the Lifeline, I also would love for more different types of voices to answer the call,
Yeah.
different accents, right? So, we as Black people, I- generally speaking, um, I know who's on the other end, other end of the line. And it would be nice if more folks of color were answering the calls,
Hmm.
because there we do, all people who answer calls are generalists, meaning that they should be able to help anyone. But
Right.
having lived experience of what it's like to be a person of color in this country means that your person on the other end doesn't have to explain things to you
Yeah.
in the way
Yeah.
that they otherwise would. And so I think there's a bunch of different ways that it needs to be addressed. I think when you think about your work with the soul shop, right? Thinking about, because I
Hmm.
think it's in barbershops, yes? Talking about, is it in barbershops or is it
No,
just
it's
mostly like churches?
churches. Yeah. Soul shops. It's
Churches.
specifically
Okay.
for faith leaders. Yeah.
Okay. So having faith leaders talk about suicide out without the idea that you're going to go to hell with even thinking of it, or really destigmatizing mental health with faith leaders
Hmm.
is, to me, a linchpin, right?
Yeah.
Because if people know from their minister, a lot of people are struggling here, I've even thought about suicide myself, you're instantly normalizing an experience that a good portion of Americans are experiencing right now in this moment. And I think when you have leaders of color talk about it, I think that the people that they are leading will start to listen. And
Yeah.
it's interesting because I do think in the Black community in particular, talking about mental health has shifted. Like I feel like, I talk to older ladies and they're like, I think I had that depression
Mm.
at some point, right? I'm starting to hear that more. I don't know if you are, which is like,
Yeah.
actually, I think I am anxious.
Yeah.
I
Yeah.
didn't realize it until my granddaughter was talking about it. But I do think that there are communities of color, specifically Asian communities, that have not move forward in the way that I would like to see, and in part because of the lack of
Yeah.
representation.
Yeah. Yeah. I think that's so true. I can even say from personal experience, I've had countless family members, um, friends I've grown up with, to come to me and say, I went through experiencing suicidal thoughts. So I've attempted suicide in the past, and they will come to me because they know the work that I do, and so for
Mhm,
them it makes me a safe person for them to talk to.
mhm,
And so I think the more that we can do that, the more that we can have people that are perceived as trusted
mhm,
individuals in these spaces. I do think it does create more of a sense of calm for people in terms of engaging in these resources and trusting these resources. I say all the
mhm.
time, people need to see themselves in the resource. They need to see themselves in the work that we
That's
do.
right.
And I am pleased to see the direction that we are trending in. First of all, 988, in my 30 some years in human services and mental health specifically, this is probably the most significant change that I have seen in my time in terms of moving forward and how
Mhm.
we do
Oh
things.
yeah.
Part of the challenge, though, that comes with that is whenever we start talking about moving the field forward, we always have to think about the nuances of where people move forward from. And not all communities are
Mhm,
at the same place on this journey of
mhm,
being accepting of mental health and mental health conversation. So the things you speak to about, those nuances of being Black, but also seeing people of color in positions of authority
mhm.
in these resources is extremely important. I do want to
Mhm.
ask you this before we run out of time, because 988, the rollout was what, a little over a year and a half ago now, I guess.
Yeah,
What's that been like? I mean, you've seen it up close for at least the last year. You've been in your role, what, a year now?
that's right.
What has it been like to see
Yeah.
this thing happen?
You know what it is I'm actually not a perfectionist. I think what is it? Don't let perfection be the barrier to progress, right?
Mhm.
So I think, but what I say is it's been incredible in part because the crisis centers are just amazing partners, and they're doing like really on the ground work. I think that the amount of attention that I see on mental health, especially around funding for different states, is like night and day in the last 2 to 3 years. I used to run a crisis center until a few years ago, so I know what it is, and I think that there is a shift in our culture, in part because people are really struggling. And so everybody knows someone with a mental health condition at this point.
Mhm.
Everybody has a young person in their life who is like, you're like, wow, then my kid has everything. Why are they so unhappy? And I hear that all the time. And I think that so to come back to your question, what has it been like? It's been like a roller coaster. But it's also, I think for me, I think about all the things that can be better. And that's why I started out with I'm not a perfectionist, but I also know we're not reaching as many people as I would like. I want us to reach people faster. I want people with different identities to feel comfortable opening up to folks on the line. I want the counselors on the line to feel like they are supported.
Mhm.
So and I try to stay in my lane. What can 988 do? What can I do? What am I in control of? But it is ultimately speaking, like I would say, an incredible privilege to do this work. And I can't say that enough. Like the idea that that my team gets to have jobs that are truly oriented towards helping people and helping people get access to services. Like, you couldn't do anything better than this. Like I couldn't be any luckier.
Wow. I think that's the perfect place to end this conversation because I will tell you this, like you, I'm not a perfectionist. But I will tell you that having you in this role makes me feel a whole lot better about the direction that we're
Mm.
trending in. It has been amazing to watch you work in this space and not just the technical expertise you bring to this work, but the humanity and the compassion that you bring to this work.
Mm.
So thank you so much for what you do every day, and thank you so much for joining me today on Strong Talk. Is there anything else that people need to know about 988 before I let you go?
I will say this. I think that everybody has mental health, right? Everybody knows they have physical health. Everybody has mental health. And there are times where your mental health is um, better or worse. And
Mm.
I think this is not just so about 988, but about mental health. And that struggling with your mental health, people often towards themselves make value judgments about their character. And I would like to de-link having good mental health with having a better character. They are not related to each other. And so if you take that part away, I think that's at the source of the stigma that we all experience around our mental health. If I'm struggling with mental health, that means that I'm a bad person or I'm somehow insufficient. So that's the piece that I'd like to de-link.
And there is that humanity I spoke of. Thank you so much, Dr. Tia Dole, for
You're
being
thank
with
you.
me today. And thank you all for joining me today, and we'll see you next time on Strong Talk. Each year during the month of February, we celebrate Black History Month, an annual celebration of achievements by African Americans and a time for recognizing the central role of African Americans in U.S. history. The event grew out of Negro History Week, the brainchild of noted historian Carter G. Woodson and other prominent African Americans. Since 1976, every U.S. president has officially designated the month of February as Black History Month. Other countries around the world, including Canada and the United Kingdom, also devote a month to celebrating Black history. But to me, Black History Month is about so much more. Black History Month represents an opportunity to rewrite and reclaim the narrative. As a Black American, I've always been taught history from the perspective of the majority. That is not to debate that it is wrong or right or good or bad. It simply is. The historical narrative has often excluded positive contributions by people who look like me. But for 1 month, the nation focuses on the accomplishments of Black people in American history. For 1 month, we have an opportunity to be more inclusive and focus not only on what is in the history books, but what is not. What has been excluded that would speak to the beauty and strength of our collective heritage as a nation. It is an opportunity to recognize the contributions of individuals like Dr. Solomon Carter Fuller, an African-American psychiatrist, who made significant contributions to the study of Alzheimer's. It's also a chance to highlight Dr. Mamie Phipps Clark, the first African-American woman to receive a doctorate in psychology from Columbia University. To me, Black History Month is an opportunity to ask, what if? What if we didn't have to view Black history through the lens of historical adversity or stigma? And what if history was inclusive of the contributions of all people every month? And that is Strong Talk.
What's the word? What's the word? Word, strong talk, what's the word?